Good afternoon, bonjour à tous. On va commencer le webinaire sur l'Italie, pour s'exporter en Italie. Julien, est-ce que tu veux lancer ce webinaire?
Bien sûr. Bonjour à tous et bienvenue au deuxième webinaire organisé par Genius sur l'international. Donc, peut-être certains d'entre vous étaient déjà présents au premier qu'on a organisé qui était dédié à l'export en Allemagne. Et fort du succès du premier webinaire, on a décidé d'en faire un deuxième, puis un troisième qui arrivera bientôt. Et ce deuxième est dédié à l'Italie. Donc, je réinterviendrai au temps du webinaire pour parler un peu de ce que Genius fait sur l'international, mais ce que je propose, c'est que les intervenants de ce jour puissent se présenter. Donc, je vais donner la parole à Fidelia.
I will just introduce here briefly that we will switch to English in this webinar, and that the other webinars coming after, which will be about Denmark, about Sweden, amongst others, will be held probably in French, but for today we will have it in English, so that it's very much inclusive. And Fidelia, actually, I would like to present you briefly before you present the digital healthcare system in Italy. So Fidelia Cascini is an assistant professor of hygiene and public health at the Università Cattolica del Sacro Cuore in Italy, and she teaches many different fields, including health statistics, health information systems, and much more. And she's also, and that's how we know her actually, a digital health expert engaged by the Director General for Digitization, Health Statistics and Information Systems at the Italian Ministry of Health, and working a lot and very intensively on European and national initiatives there. And I've been knowing her for many digital health projects, including TEDx2, but also others where she's strongly involved. And the other speaker who will come right after Fidelia with a presentation on Curity, an entrepreneur actually who has had the experience of going to the Italian healthcare system with the digital health innovation, is François Champoiseau, who is CEO of Curity, and Curity seeks to improve the care offering of oncology patients in the European Union. So the goal of this presentation today is to have first Fidelia present the digital healthcare system, a little bit like the page on Genius, but a bit more detailed. Then have a presentation by Julien on Genius and what it actually offers to entrepreneurs. And we will finish with a presentation of a real-life experience by François on Curity. And now the floor is yours, Fidelia.
Thank you, Luisa. Thank you very much for your presentation, and also thank you and the Ministry of Health team for inviting me to discuss and present the situation in Italy. I'm going to share my screen, and I would like to share with you in particular what is the situation of the healthcare system, the context of the healthcare system in Italy, what are the challenges and the opportunities that we are facing for the digital health transformation. So I hope you can see my screen. Please
Yes.
confirm. Okay, perfectly. So how is organized the Italian healthcare system? First of all, it is a system which has the goal of universality and equality. So it is based on a beverage model, and it is funded by public revenues. So there are the citizens that are contributing to finance the national healthcare system. The organization is structured in a hybrid as a hybrid organization, because we have a centralized service, a centralized organization, but also a decentralized provision of services which are provided by the regions and especially by the local health units, which are operating at the local level. So each regions need to guarantee the provision of essential level of assistance. assistance. And I want to show you more deeply how it is structured. As you can see, the patient can choose where to go to receive healthcare services, but the indication, the direction for the goal of each year, for the goal that the national health system has to reach, are defined by the Ministry of Health. So the Ministry of Health defines fundamental health principles and acts as a point of liaison and guidance on healthcare policies. But the provision of healthcare services and the concretely implementation of the services are managed by the regions, the 21 regions that we have. So the regions drive health policies, organize and manage healthcare services autonomously. So each region can evaluate based on healthcare populations, but healthcare needs of the population and his context, what kind of services are needed and how to manage the provision of the essential level of assistance. These services are finally provided by the health units, which are composed and included both public and private organizations. Private organizations are accredited with national health services. They support the provision of services from which are provided by the public organizations through the local health units. What are the challenges that we are facing in Italy? We have several challenges, some due to the innovations, technological innovations, which is bringing a high price for pharmaceuticals and for the implementations of these new services. We are facing some difficulties because of demographical factors, as those related to the elderly population. You know that in Italy, almost 23% of the population is over 65 years old, with a prevalence of chronic diseases. And this means that more than half of costs related to healthcare services and costs related to pharmaceutical expenditures, and more than half of hospital admission are related to demographic factors. But we have also another important challenge, which is that related to regional inequalities. We are recording differences in healthcare quality and accessibility to the services if we compare northern and central regions with the southern regions. And this is in particular evident when we look at the cancer screening program, because we have in the southern part of Italy regions where we have a high level of avoidable, preventable deaths, and also it is related to an education factor, because in the southern part of Italy do not follow a healthy lifestyle that can help them to improve their quality of life and to prevent illnesses. The current opportunities, especially related to digital health, are those coming from the investments that Italy is implementing starting from 2021 with the Next Generation Italy plan, the National Resilience Plan. In particular, the Mission 6 of this plan is dedicated to health, and it includes more than 15 billion of euros for digital transformation of the national health system. And this investment is mainly divided into two components. The first one to improve local network and facilities, but mainly the telemedicine services for local healthcare. And the component two, which is related to innovation, research, and digitalization of the national health system. Looking in detail into these components, related to component one, we have the improvement and the implementation of the electronic health records. We reached the second level, the second issue of these electronic health records, which is digitalized by design, which is based on data for collecting the history of the patient and all the documents of the history of the patient into the electronic health records, which each patient has as his own electronic health record. So each region in all the Italian territory implemented these electronic health records, and each patient has his own electronic health records to view and to upload and download documents related to his history. But regarding the use of these electronic health records, we can see that the usage by primary care physicians reached a good level, so 96% of physicians in the local health unit, the local health authorities, is enabled to access and to use the electronic health records. And it is also a service which is used by hospital specialists, a little bit lesser than other physicians from primary care, but it is a good level that we reached. 64% of specialist physicians at a local level which are enabled to use this service. But we are implementing it, and we faced some difficulties to help people to use this service, because people the patient is not yet familiar with this service, and we are trying in Italy to help people to understand, to better know how this kind of service works. But the most important investments that we implemented in Italy concerning the digital health is that related to telemedicine. So right now in Italy, we have 4 main services, telemedicine services, which are patient-doctor teleconsultation, doctor-doctor teleconsultation, telemonitoring and teleassistance, that are implemented and will be in the future years more disseminated and used in all the Italian regions to allow chronic patients and patients which are more than 65 years old to use this kind of services to avoid to reach hospitals, especially if they live in rural areas and it is difficult to receive assistance and the continuity of care. So these services include several components which are interoperable across regions. And these components, some of them are essentials, others can be implemented as complementary by the different Italian regions. So as core components, which means that all the regions to provide these telemedicine services have to implement, they have to include into these telemedicine services these components are, for instance, document sharing, video conference, chat messaging, patient onboarding. But other regions that maybe are more advanced or need to invest more in some of these services can use also other complementary services, as for instance, digital signature, booking management system, and so on. Further, linked to these telemedicine services, some regions can implement also experimental services, such as those related to the implementation and the use of artificial intelligence systems for forecasting, for evaluation of planning healthcare, and other kind of activities related to the use of artificial intelligence algorithms. So what are the goals that we have to reach to respect the National Resilience Plan? At the regional level, we have to reach specific goals, which are goals that are different considering the different regions, because every region adapts his plan to implement telemedicine services to specific target, and especially taking into account the number of patients to treat with telemedicine services, the amount, the burden due to chronic diseases that have to be managed through telemedicine services, and also what kind of telemedicine services should be implemented more and more advancedly to support this kind of targets. So you can see that the plan could be very different from the number of patients, the type of pathology, and the type of services if we compare the different regions. But the most important architecture that we are building to sustain the provision of telemedicine services at the regional level is that based on the integration of these services with a central infrastructure. In particular, you can see that the infrastructure of telemedicine include a governance and dissemination portal, which is the platform, which is the architecture to monitor the implementation and the provision of telemedicine services in the different Italian regions. And we have related to this platform, related to this portal, another platform, which is the platform used to enable services and to provide essential services. So this national platform is the platform that allows interoperability, connection, harmonization of regional telemedicine services, and the platform which is connected with other central services, as for instance services for the identification of patients and also professionals, services which are those related to electronic health records, because the telemedicine data, telemedicine information can be included into the history of the patients and the documentation of the patient that are the base of the electronic health records. But also we have the integration with other centralized services as those related to the vaccination and other anagraphical documentation related to each patient. So the idea of building this telemedicine architecture is to create an integrated structure to include, to connect these services with other services related to provision of healthcare. How the Italian system is updating the inclusion and the provision of healthcare services supported by telemedicine with the new medical devices and apps. I mean, what is the mechanism that can allow an advancement and an update of technology with this existing architecture and this existing system to monitor the telemedicine services. Including in the plan of telemedicine services provision, the Italian national health system realized a program, a plan to check if the new medical devices or new applications that can be used for the provision of telemedicine services are compliant with the information technology and regulatory requirements to be aligned with the expected outcomes. So we have an organization internally to the National Agency for Regional Services, AGENAS, which is also the Digital Health Authority, the Digital Health Agency, an organization which will be used to validate the new proposed tools and to insert them into a national catalog. So once these new solutions are inserted in the national catalogs, they can be also monitored by this competent authority and periodically evaluated to be sure that they are compliant with the requirements that we are expected based on national and European legislation, but also with other technical requirements as interoperability and other kind of requirements. So this is the system that we are going to build to develop a national health service. For the future, and I'm closing my intervention, what I can say is that this is the first step of future investments that are strictly related to the European Union direction, especially for the cross-boarding services, which include both primary use and, in fact, also for telemedicine services. We are involved in joint actions for the improvement and the alignment of these services with other member states, but also regarding the secondary uses of health data for the improvement of research, healthcare plan, and other activities. And that's it from my side. Francois, the floor is yours.
Thank you. I'm very happy to present you the progress we made in Italy with Curity. I'm François Champoiseau, the CEO of Curity, and I will share with you a few slides. Can you see my screen?
Yes.
Yeah, so Curity is the leading remote monitoring platform for cancer patients in Europe. We are operating in France, Italy, and Spain. We launched the company in 2018, and we are now partnering with 120 institutions in Europe, and we account 50 full-time employees. We have monitored so far 17,000 patients. 11,000 of these patients have been recruited over the years, and 11,000 patients have been recruited in 2024, among which 1,000 were recruited in Italy. So what we do at Curity is remote monitoring of patients, so triage of patients that are enduring IV or oral treatments during cancer. We try to help patients and nurses. We try to help nurses and doctors to prioritize the care of patients who need it the most. And we try to educate the patients in parallel to help them self-manage minor adverse events so that the hospital doesn't have to deal with minor adverse events and focus on patients who need it the most. We completed several studies over the years and we have demonstrated several benefits. So the main benefits we have demonstrated so far are the fact that we are reducing the average duration of hospitalization. We did demonstrate that in monocentric randomized studies with around 100 patients, where we demonstrated a reduction of 61% of the duration of hospitalization when patients were monitored. We also demonstrated a strong impact on the reduction of phone call, entrant and outgoing phone calls for nurses, with a 66 reduction of these phone calls for nurses. So what we do is to integrate the remote monitoring system into all ambulatory care clinical processes, so that the use of the platform help streamline all the processes and alleviate a lot of tasks that were done over the phone or by mail by nurses while helping managing these patients. The core of the system is a software medical device with an algorithm that is configurable for all treatments. And it is a specificity of Curity to be able to adapt the algorithm of the software medical device depending on the treatments patients are receiving, which is enabling our platform to propose a system that is really close to the clinical experience. So we have, of course, assessed the performance of the algorithm. And when we went to Italy, to the Italian market, we shared with the Italian clinical teams all the work we did on the algorithm, on the regulatory part, and all the studies that were performed in France, of course, to gain their trust and start collaborating with them. So this is a snapshot of our network in France and Italy. We are now partnering with 4 leading institutions in Italy, 3 university hospitals and 1 leading private hospitals called IO being the largest hospital organization that are treating oncology patients in Italy. And what we did to achieve this deployment in Italy was pretty simple and pragmatic. First thing you need to know is that the hospitals in Italy have a different level of autonomy depending on their size and their status. So if you are a small hospital or a medium hospital, a public one in Italy, you are strongly dependent on what the region is deciding in terms of health policies for your hospital. So you don't really have free hands to do and experiment innovative solutions. So what we decided to do when we entered the market 2 years ago was to target leading private hospitals and leading public hospitals to start collaborating with them. And we also decided not to go through public tenders when addressing public hospitals, and not to try to get funding from the budgets that were presented earlier by my colleague. In fact, we were told that all the budgets that was given at European level to foster digitalization, etc. Every time we were going to the department managing these budgets in public hospitals, we were being told that it was super difficult to unlock part of this budget for any remote monitoring project. So we had to go through other innovating route, I will say, through financing, partly financing of pharma industrial for public hospitals, and through public research funding. And when it comes to private hospitals, we have full autonomy to negotiate a partnership and negotiate a license fee with this type of hospitals. So we provided our platform with a paid license fee on an annual basis. And with IO, as you can see the numbers, we are pretty happy to now monitor roughly 1,000 patients. And we've been able to deploy step by step the platform with interoperability with their system, and also launching a clinical study project to assess the impact of our platform in Italian settings. So what we aim to do as a software medical device, we aim to demonstrate the benefits, the organizational benefits of our platform in Italian settings, and also the clinical benefits for patients. So we have already one study that is almost completed with IO, where we are demonstrating a very strong impact in terms of organizational benefits, a reduction of the email and phone call burden, and a reduction of unnecessary, unprogrammed, scheduled consultation and unprogrammed hospitalization. And we aim to further enlarge the collection of evidence with public hospitals associated to IO. And we have also partnered with IOM, which is the association in Italy for medical oncology, that is managing the whole network of oncology hospitals. And IOM is looking to establish a national trial with public hospitals to foster remote monitoring adoption and establish real-world evidence of the benefits of Curity in Italian setting in a large trial, so that we can negotiate a reimbursement with the Italian authorities. So it will be quite a long route for us, but we are working with the right partners to achieve that. And prior achieving a business model with a reimbursement like we have in France, we have a paid license fee with leading hospitals that are agreeing to pay for it. And we managed, I would say, some innovative routes to achieve a funding where it was a bit complicated at first to work with public hospitals. So this was just to share a few numbers of the patients we are following in Italy. And if you have any questions, I'm happy to answer it.
Merci beaucoup à vous deux pour cette présentation qui était très claire. Donc, avant de passer aux questions-réponses, je vais vous parler un peu de Genius. Donc, j'ai vu qu'il y avait certains qui connaissaient déjà Genius et d'autres qui ne le connaissaient pas. Donc, pour ceux qui ne connaissent pas, présentation assez rapide. Donc, je vous mettrai des liens sur le chat pour que vous puissiez aller voir un peu ce qu'est Genius. Mais je vais partager mon écran parce que c'est toujours mieux que de vous montrer concrètement ce que c'est plutôt que de parler. Donc, Genius, c'est un site internet qui est fait par le ministère de la Santé, qui a un seul but, c'est vous simplifier la vie. Et comment on vous simplifie la vie? Et bah, du coup, c'est avec Genius, c'est avec ce site. Donc, comment on procède? Genius a 5 ans, il est né de la feuille de route du numérique en santé, et en fait, on avait fait un sondage auprès de tout l'écosystème qui nous disait, à juste titre, on ne sait pas qui fait quoi, on ne sait pas qui contacter, on ne sait pas comment trouver des financements à un endroit où il y aurait tout. On ne sait pas quels sont les événements qui se passent autour de chez nous. On ne sait pas non plus la réglementation, comment ça fonctionne, qui c'est qu'on va contacter, à quel moment. Et quand on trouve des sites, on met 15 ans à trouver une information et quand on la trouve, elle est périmée depuis 2 ans. Donc en fait, on est parti de ce constat pour faire un site qui va à l'essentiel, où il n'y a pas de blabla. Donc comme vous pouvez le voir, ça c'est la page d'accueil. Il n'y a pas grand-chose à lire et toutes les informations qui sont mises sont bien pesées pour justement savoir si elles vous sont utiles ou pas. Donc, sur Genius, vous allez retrouver plusieurs choses. Donc, je vais passer vite, parce que ce n'est pas le but du webinaire, mais vous pouvez retrouver des financements. Donc, savoir quel est le bon financement adapté à mon projet. La réglementation que vous devez appliquer avec différentes fiches, et les fiches sont très didactiques, c'est-à-dire que vous avez des fiches qui vont vous dire si vous êtes concerné par le sujet, et si oui, vous allez pouvoir continuer dans la fiche et trouver les informations qui vous conviennent. Les acteurs, on a listé tous les acteurs français importants, incontournables, qui vont vous aider dans votre recherche. C'est-à-dire qu'au tout début de la page, vous allez voir si vous êtes concerné par l'acteur ou pas, et si vous êtes concerné, qui contacter, à quel moment, et à quelle adresse. Donc, on va vraiment au but. On parle souvent de la SASN, Stratégie d'accélération santé numérique, du Ségur, de la feuille de route, et parfois ça peut être un peu abstrait quand on débarque dans le numérique. Programmes nationaux est là pour vous aiguiller, vous expliquer un peu à quoi ça correspond, et pour vous montrer, pour vous dire que je ne raconte pas de bêtises, ça c'est par exemple la page sur la feuille de route. Donc voilà, c'est très court, on va à l'essentiel, on vulgarise grandement, et là vous avez de la documentation, vous pouvez aller voir un peu plus dans le détail si ça vous intéresse, et vous retrouvez les actualités, les événements de la e-santé. Les actualités, ça peut être les appels à projets, les événements, ça peut être un événement à côté de chez vous, c'est pas forcément que Paris, et les podcasts, où vous pouvez trouver notre podcast qui s'appelle 100 jours pour réussir, où on interviewe un peu dans le système qu'on a fait là, c'est-à-dire un entrepreneur et quelqu'un qui est plus académique ou institutionnel pour parler d'un sujet. Et aujourd'hui, on est tous ensemble pour parler de l'international et on a un service, je vous avez mis le lien dans le chat, qui est décrypter la e-santé à l'international. Donc, on a fait un peu le même système que les pages acteurs, mais pour les pays. Donc, vous voyez, il commence à en avoir beaucoup. Et pour chaque pays, on a fait un peu la même façon. Donc, quand vous allez sur la fiche de chaque pays, je ne vais pas vous mentir, vous ne serez pas expert du pays dans la e-santé. Mais par contre, vous aurez tous toutes les bases à connaître sur ces pays. Ça va des chiffres clés, des autorités à connaître. Voilà, on a essayé de trouver un peu les... C'est compliqué, chaque pays a ses spécificités, on ne peut pas forcément être comment dire, toujours... Il n'y a pas toujours l'exact équivalent dans chaque pays. Donc, on a essayé un peu de vulgariser toujours, donc les clients du ministère de la Santé, du Conseil d'administration, l'Institut national de la santé, etc. Les associations, les initiatives, les formations. Donc, vous retrouvez toutes ces informations et notamment, ce webinaire, vous le retrouverez en replay sur nos réseaux. Et en parlant de réseau, justement, je vous ai mis là dans la boucle de chat, c'est quelque chose que je vous invite à surtout suivre le compte LinkedIn. Pourquoi? Parce qu'en fait, on va publier, il y a plein de nouveaux services qui vont arriver, qui ne seront pas forcément que sur l'international, mais c'est vrai que sur Genius, vous n'allez pas y aller tous les jours, je ne me fais pas de l'heure, mais sur LinkedIn, comme on publie nos nouveaux services, il y aura peut-être un service qui va vous intéresser à un moment. Donc, si y a quelque chose qui vous intéresse, comme ça, vous pourrez le voir et être alerté. De même, vous retrouvez tous les événements, et s'il y a des événements que vous organisez, vous pouvez nous les soumettre via le lien que je mettrai dans la boucle dans quelques instants. Donc voilà, j'ai été assez rapide, un peu comme le site, j'ai été à l'essentiel. Donc si vous avez des questions, on va passer à la séance de questions-réponses. Vous pouvez poser en italien, en anglais, en français, après dans d'autres langues, puisque Louisa sait parler toutes les langues. Donc voilà, et on va essayer de répondre aux questions. Et même si vous avez des questions sur Genius, vous pouvez nous les poser. Donc voilà, en tout cas, merci d'être venu au webinaire. Et voilà, si vous avez des questions, n'hésitez pas à lever la main ou alors les poser dans le chat et on y répondra si on a la réponse.
Merci infiniment pour cette présentation, Julien, and thank you so much, François and Fidelia, for your great insights. If I may kick off the round of questions, because I haven't seen one yet. I have one for Fidelia, actually, because you mentioned also the differences in the regions and that some are more advanced than others. Could you give us some detail or maybe even a recommendation? If you were an entrepreneur, what would be kind of the most receptive region as of now to go to in Italy?
One of the considerations that an entrepreneur should do is what is the service that he or it is interested into implement. I mean that it depends on the kind of service and the illnesses, the diseases which are the target for this digital health service. Because as I showed you before, there is a difference also in the healthcare needs of the population. So the implementation of services is strictly related, and also the opportunities related to the investments are strictly related to the needs of a population. So one suggestion is please consider the context of healthcare needs before starting with some kind of investments. And the needs, maybe also the investment who could support at the best and could be also more accepted as something which is useful for an improvement.
Thank you, Fidelia. So there's no one-size-fits-all solution. So it depends on the pathology, as you said, and somewhat the region has maybe a preference for different pathologies. So entrepreneurs need to check closer what the regions do. And Julia, maybe you're moderating the questions, but I already see one here in the chat, maybe for Fidelia. There's someone asking whether it's important to contact directly the hospital. So the question just says this, so I don't know if there's any more detail from the question, but as an entrepreneur, can they directly contact the hospital directorate?
It depends, as Francois said before, you can use a double level strategy. One is thinking about private investments and private hospitals that can manage easily the type of services and the implementation that they would like to implement or to experiment. It depends on the local situation. But if the intention of the investors are those related to a broader implementation of services which involve a larger territory, it is best to follow the way where the interaction with authorities is preferable, because you need authorizations, permissions, and also you can participate also to a specific call for investments, and it could be useful for future services that are in plan and are included at the regional level within the services of that are not only for essential level assistance, but also for other kind of services that can be different comparing different regions. So it depends on what is the strategy that the industry would like to follow.
If I can complement, I re-insist on the fact that yes, your main customer will be your users, and there won't be any IT department or general manager of any hospitals buying your solution or pushing for your solutions to be used. If there is not any interest, there is no interest from the medical team. So in parallel of addressing the general management and or IT department, addressing the direct users, the key opinion leaders of the hospitals is critical. And addressing the leading hospital of the pathologies that you are targeting is of course the most important strategy.
Thank you.
I see that there is a question.
Yes,
there is
indeed.
a question related to AI specifications or specificities. I can say regarding this that there is a great attention towards AI tools, but the situation right now is that you can't use AI tools for the provision of healthcare services which are reimbursed or which are implemented by the national health services or national health system. So if you would like to explore how AI tools can be used for specific population of targeted illnesses, you can do it, but it is within an experimental ground. We are not ready for the implementation on a larger scale with a recognition of these AI tools for the provision of healthcare services, I mean, from the national health system. We are studying right now, we are experimenting, we are testing, because as you know, right now we are not confident, also based on the evidence, scientific evidence, with the all the available AI tools that we could use for AI, for healthcare provision. So it is something which will explode in the next future, but right now we are evaluating.
Thank you, Fidelia, and I hope this responds to Sonia's question, Catherine's question actually, which was quite large, and you tackled the AI part of it, and I guess it applies also to other EU member states, taking into account the different regulations affecting us. Anything you want to add on that, Francois, related to AI-based solutions? Not sure if it applies to your case.
We don't have stricto sensu, we don't have AI in our platform. So it's a medical device. It needs to be a regulatory grade for any hospitals to use it. So we did demonstrate all the regulatory work that has been done and certified by third parties to achieve the deployment in routine care.
Thank you so much. And just as a side note here, at the EU level, we're also trying to harmonize evaluation of AI-based digital medical devices. So hopefully we'll also get to some form of agreement, like a little bit like what's happening for medicines, where there's also a joint evaluation procedure. And ideally we'd have that also for digital medical devices, so that both in Italy and in France and in Germany, for example, we have similar evaluation methods thereof. But just as a little side comment here. I'm not sure if there are any other questions. Julien, are you aware of other questions? T'as vu d'autres questions? François, Fidelia, if you have questions to each other, you can also ask them now. You're all good?
Really.
Great. Well, we'll have anyways the Genius page for Italy still online, and we're looking forward for more audience on this. And I would say, Julien, we can close. On peut fermer le webinaire si c'est OK pour toi. Stay tuned, and next one will be in February on Denmark. So looking forward for another country insight. And thank you so much again, Fidelia and Francois, for your precious time and your insights. And thanks, Julien, on the Genius part. Bye-bye, everyone.
Bye.
Merci à tous. Au revoir.
Grazie mille. Bye.